And it goes a little something like.
Hi, good day, ma'am. I'm Kristel and I am your nurse for today. So, ma'am, may I know how are you feeling?
I'm okay.
Have you already eaten your food, ma'am?
Yes.
Ma'am, may I know what is your name?
Annabel Torres,
How about your birthday, ma'am?
September 8, 1979.
Ma'am, may I know before you came here, how's the weather outside?
The weather is good.
Do you think your clothes are appropriate to the weather?
Yes.
Are you comfortable with it?
Yes.
Ma'am, may I know, do you feel any dizziness, numbness, pain, or any tiredness now?
No.
Okay, ma'am, may I know also what is your previous vital signs, specifically your temperature and your blood pressure in your home?
My body temperature is 36.2 and my blood pressure is 120/80.
So, may I know again, ma'am, if you have already experienced getting your vital signs, do you know the procedure, ma'am?
Yes.
Okay, ma'am, please allow me to discuss it again. I just need to put the specific equipment to your specific body parts. For example of this is the thermometer. The thermometer will be put to your armpit, okay? And then by getting or knowing the procedure or your vital signs, we can easily identify what are the best cure or treatment that we need to implement to you, okay? So, ma'am, I will get your vital signs. Will you allow me?
Yes.
Okay, ma'am. Wait for a while. Ma'am, please allow me to close the curtains for your privacy. Before applying the procedure, don't forget to sanitize your hands using the alcohol or the hand sanitizer and gloves yourself or your hands. Gently and appropriately expose the measurement site. By the way, if the armpit is moist, pat it dry with paper towel and don't forget to discard the towel into the trash receptacle. Get the thermometer and remove the probe from its container. Don't forget also to disinfect the thermometer first from bulb to stem. By the way, use cotton balls from disinfecting this specific equipment. Press the scan button on the unit and wait until it is reset to 0. Place the tip of the probe in the center of the client's armpit. The thermometer should be in an upright position between the armpit and chest. Wait until the digital reading is displayed or an end sound is heard. After removing the probe from the client's armpit, read the temperature on the digital display, and the temperature of my client is 36.2, and don't forget to disinfect again the thermometer from bulb to stem. Help your patient to supine position. And then first, you need to sanitize or disinfect your stethoscope before using it. And then open your stethoscope and check it. First thing that you do is to locate your anatomical landmarks to identify point of maximal impulse. And then carefully move fingers down left side of sternum to 5th ICS and laterally to left mid-clavicular line. Place diaphragm of stethoscope in palm of hand for 5 to 10 seconds. Place diaphragm of stethoscope over PNI at 5th ICS and auscultate for normal S1 and S2 heart sound. You will hear the lub-dub sound. And then disinfect again your stethoscope after using it. When you hear S1 and S2 with regularity, use second hand of watch and begin to count rate. When sweep hand hits number 12 on dial, start counting with 0, then 1, 2, and so on. If apical rate is regular, count for 30 seconds and multiply by 2. And lastly, of course, note if heart rate is irregular and describe pattern of irregularity. Help your patient to get into supine position. If supine, place patient's forearms straight alongside body or across lower chest with wrist extended straight. If sitting, bend patient elbow 90 degrees and support lower arm on chair or on your arm. Place tips of 2 or 3 fingers of hand over groove along radial or thumb side of patient inner wrist and slightly extend or flex wrist with palm down until you note stronger pulse. Lightly compress pulse against radius, loosen pulse initially and then relax pressure so pulse become easily palpable. Determine strength of pulse. Note whether thrust of vessels against fingertips is bounding. 4. Full strong is equivalent to 3, normal or expected is equivalent to 2, and diminished or palpable is 1 and absent is 0. After feeling a regular pulse, look at second hand of a watch, begin to count rate. Count the first beat after the second hand hits the number on the dial, count as 1, then 2, and so on. If pulse is regular, count rate for 30 seconds and multiply by 2. If pulse is irregular, count rate for 1 minute or 60 seconds. Assess frequency and pattern of irregularity. The radial pulse of the patient is 76. Be sure that the client is in comfortable position, preferably sitting. Be sure that the client chest is visible. If necessary, move bed, linen, or gown. Place patient arm in relaxed position across abdomen or lower chest, or place hand directly over patient's abdomen. Observe complete respiratory cycle. After observing cycle, look at second hand watch and begin to count rate. When swift hands hits number on dial, begin time frame and counting 1 with full respiratory cycle. If rhythm is regular, count number of respirations in 30 seconds and multiply by 2. If rhythm is irregular, less than 12 or greater than 20, count for 1 full minute. Note depth of respirations subjectively assessed by observing degree of chest wall movement while counting rate. You also objectively assess depth by palpating chest wall excursion or auscultating posterior thorax after rate has been counted. Describe depth as shallow, normal, or deep. Note rhythm of ventilator cycle. Assess the frequency and pattern of irregularity. Observe inhale and exhale and ask the patient to describe subjective experience of breathing. When using your patient's finger as monitoring site, support lower arm. Instruct your patient to breathe normally. When using finger as monitoring site, remove fingernail polish on one finger with acetone or polish remover. Acrylic nails without polish do not interfere with SpO2 determination. Instruct also your patient that the clip-on probe feels like a clothespin on finger but will not hurt. Attach sensor probe to monitoring site, and once the sensor is in place, turn on the oximeter by activating power. Observe also the pulse waveform or the intensity display and audible beep. Correlate oximeter pulse rate with patient's radial pulse. Differences may require re-evaluation of oximeter probe placement and may require assessment of pulse rates. Leave probe in place until oximeter readout reaches constant value and the full strength during each cardiac cycle. Inform also your patient that oximeter will alarm if probe falls off or patient moves probe. Here's the pulse oximeter, and don't forget to sanitize it first. Place the pulse oximeter in the index finger of your patient. Wait for almost 60 seconds or 1 minute. Remove the pulse oximeter in your patient's index finger and read the SpO2 on digital display. Don't forget to disinfect again the pulse oximeter after using it. Continuous SpO2 monitoring is necessary and verify SpO2 alarm limits and volume. Determine limits for SpO2 and pulse rates alarm on basis of each patient's conditions. Assess skin integrity every 2 hours and under sensor probe. Relocate sensor probe at least every 24 hours or more frequently if skin integrity is altered or tissue perfusion is compromised. Position your patient by sitting or lying. Position his or her forearm at heart level and turn his or her palm up. If sitting, instruct patient to keep feet flat on floor without crossing legs. Disinfect first your blood pressure apparatus before using it, and don't forget to expose arm fully by removing constricting clothing. Cuff may be placed over shirt sleeve as long as stethoscope rests on skin of antecubical space. Position cuff 2.5 cm or 1 inch above site of pulsation. Wrap cuff evenly and snugly around the extremity. Position also your manometer gauge vertically at eye level and no further than 1 meter away. Disinfect your stethoscope, of course. And then open your stethoscope and check it. After it, palpate brachial artery with cuff fully deflated. Apply bladder of cuff above artery by centering arrows. Mark on cuff over artery. By the way, if there are no center arrows on cuff, estimate center of bladder and place it over artery. Check the blood pressure. After checking the blood pressure of the patient, don't forget to disinfect again the blood pressure apparatus and the stethoscope, of course. After disinfecting the blood pressure apparatus, fold it and put it to the tray. Ma'am, how are you feeling?
I'm okay.
Are you comfortable?
Yes.
Okay, ma'am. Thank you so much.
Okay, thank you.